So it looks like it's just us right now. Oh,
It
I
does
do see some
people.
people. So hi, welcome everybody. We're gonna give a few minutes for others to join before we officially begin. So we hope you've been enjoying the summit, and I know there was just a very powerful keynote speaker. If you were in that session, I know gave me a lot to think and reflect on and a lot of feelings. So as Ashley has shared, please do what you need to care for yourself through the whole process of this summit. See, we still have folks joining. I may begin with our housekeeping just so that we can honor starting and ending on time. And so I am going to share a bit of information with you all. I want to officially welcome you to this session and let you know that my name is Lisa Brock. My pronouns are she and her, and I am an ECHO program manager at the American Academy of Pediatrics. And we are one of the contributors to the National Training on Technical Assistance Center for Child, Youth, and Family Health. As you may have heard in some other sessions, we've got some housekeeping items, and we'd like to remind everyone of our commitment to maintaining a safe and accountable space. If you have any issues and need assistance, you can reach out to me directly, and I will do my best to assist you. As many of you will see, I'd like to draw your attention to the tools in the session. There's a vertical bar at the bottom and several icons on the right side of your screen. If your event feed is open, it's going to be hiding your vertical bar. So you may want to close that by clicking on the X in the right-hand corner of the event feed box, and that it's like a chat box for the entire event rather than for this session. So we want to make sure that's closed. We do encourage you to use the chat box and the Q&A for this session. To enable us to keep up with the questions, we ask that you use the Q&A icon with the speakers. Again, it's the third icon from the top with a Q&A on the vertical bar. So if that isn't working for you and you can't find it, you can go ahead and put things in the chat box too. You've got a flexible, wonderful group here, and we're going to make it work for you today. And lastly, we'll go ahead and get started. I am so pleased to officially welcome you to this session titled Youth Justice and COVID-19 Pandemic, Lessons, Strategies, and Pathways Forward. We have a number of speakers for today's panel. I believe that Samantha is going to be leading the panel, and she will begin with introductions. But I'd like to thank Jeanette, Regina, and Tracy for being here as well. And with that, you can begin whenever you're ready.
Thanks so much, Lisa. I'm going to start by seeing if I can share our slides. Go. All right. First step, success. Thank you so much. Thanks so much to everyone who has joined us today. I'm very excited and honored to be presenting with the esteemed panelists on this panel who have been close partners on the collaborative effort that we are going to talk through today. My name is Sam Harvell. I'm an independent consultant working with the Justice Policy Institute on this project, and I'm very excited to share with you some of the lessons learned throughout the project. Today, I will give a quick intro when I do some questions to each of our panelists, but we have three incredible colleagues in the field, Ms. Gina Mitchell, Ms. Jeanette Bocanegra, and Ms. Tracy Tucker, who you will be hearing from momentarily. I'm going to try to take up as little time as I can because they're the central experts here. But I wanted to take just a moment to talk a little bit about the background for this project. So in 2020, which seems like sort of almost a lifetime ago now, 4 national research and advocacy organizations came together to study state and local policy and practice changes that were focused on reducing reliance on youth incarceration during the pandemic. And those 4 organizations were the Center for Children's Law and Policy, Justice for Families, the Justice Policy Institute, and the National Juvenile Justice Network. It was a really powerful combination, each of those entities kind of leveraging their constituency and their colleagues and partners to bring various perspectives to bear on the question of what was happening around decarceration efforts in the youth justice system in the pandemic era. The goals of the project were to identify lessons learned that other communities and localities could potentially learn from, to provide useful materials to stakeholders, families, leaders, and other advocates who are working to change and improve systems across the country, and also to develop evidence-informed recommendations for future reform efforts. This project took a couple of years and culminated in several publications, all of which are in the resource section here and linked below. Essentially, we focused on primarily 5 sites. And so you'll hear us talking some about those 5: Harris County, Texas, New York City, Pierce County, Washington, and then the states of Maryland and Utah. And we had the incredible opportunity to speak with advocates, with directly impacted family members, and with system stakeholders in each of those locations through a variety of different methods, some surveys, some one-on-one interviews, some focus groups. And we pulled all of that together to share what we thought were some really interesting examples and lessons learned from the field in a variety of publications, including sort of deeper dives into each of those communities, if you're interested in looking more deeply in any of those. And then also in kind of topical focus areas. What did we learn from families? What did we hear from advocates? And what did we hear from system practitioners? So would encourage you to reference those if you're interested in more on the topic, and also always happy to connect with you all. So just very briefly, it's hard to cover all of this rich material in a short period of time, but I did just want to highlight some of the interesting things that we found. And I think the main takeaway from all of this is that individuals in jurisdictions across the country leveraged the discretion that they had to make some different choices during the COVID pandemic, and the danger that this public health issue spread to kids, particularly those kids and staff, honestly, working in confinement facilities, really intensified efforts to remove kids from those facilities whenever possible. And so, like most reform efforts, we found that kind of the pillars were similar, but some of the strategies, all of the strategies were unique, and some of them are really interesting, and how kind of quickly they were implemented and how impactful they were in getting kids home and keeping kids and families safe. So in that publication, there's a ton on this, but just, in these 4 pillars, first of all, strategies that tried to divert kids away from the system entirely. Really interesting examples from New York City, where the Department of Probation worked with prosecutors and the police department to develop a whole new process for processing kids who came in and get them back home when they didn't have to go to a central processing unit. Baltimore, Maryland, for example, the prosecutors there stopped charging for certain offenses like drug possession and sex work offenses, and advised officers to use discretion in arrest decisions to try to limit the number of young people going into the system. For those who are already in secure settings, lots of different ways of expediting release. All of the localities we looked at really took an individualized, intensive approach to case review and management to see who could safely go home and how to implement plans to get them there. Another interesting example in Harris County, the probation agency there created a whole new staff position, a facility population manager, whose job was just that, a position that remains today, just focusing on, are kids getting hung up? How can we get them moving through the process and back home more quickly? We saw also communities leverage technology and virtual engagement options in really interesting ways through kiosks and remote hearing capability and even some remote treatment. And one of the kind of benefits of COVID in some communities, it's hard to say, given how it's an odd thing to say, given how horrible COVID was, obviously. But there were several sites that in which the kind of shift to some virtual service delivery actually broke down barriers and opened up opportunities. So, for example, in New York City, practitioners were able to refer young people to services across borough lines, which hadn't been possible before. Similarly, in a state like Maryland, that's large and diverse with many rural areas, they were able to provide certain access to services to kids in rural communities that hadn't had that access before. And last, and I think perhaps most importantly, I think each of the communities we looked at really got creative in thinking about what community supports were needed and how to invest in comprehensive supports for kids and families. In Harris County, for example, we saw this look like resource transfer to grassroots organizations that provided everything from hot meals and groceries and personal protective equipment to technology, medical services, remote counseling, et cetera. And interestingly, in Harris County, they also leveraged some of that work to build a community reinvestment fund to try to create some sustainable funding moving forward. So I give just a few examples because I think there is really some power in this creative thinking and thinking about how we can continue to move forward and build on what we've learned and what we know from the COVID era. As horrible, and not that it's over, to be fair, we're still in it. As horrible as it was, it did force us to really think about which kids need to be in placement and how can we more effectively support them at home. I'm going to leave it at that, though there is certainly much more to be said there, but I'm going to let our other speakers share from their unique perspectives. And I'm going to start with Gina Mitchell, a director at the Center for Children's Law and Policy. And Gina, I'm hoping you can share with us what the key takeaways were from the practitioners that you all spoke with in terms of which strategies were most effective in reducing the number of young people in facilities and investing in community infrastructure.
Absolutely. Thank you, Sam. I'll just share that, when we started this project, we realized that the pandemic forced systems to look at, when I say systems, I'm talking about like the youth justice system, the practitioner piece of the work. It forced them to look at their purpose and use of detention. So the pandemic made systems realize that, their emergency preparedness plans were not necessarily ready for something such as this. Everybody was fearful, from systems and staff people to being concerned about the young people as well. Congregate care was a terrible place to be during the pandemic on either side, whether you were working in the system or you were a young person that was in the system as well. And so this made everyone be able to think quickly on their feet and be able to pivot. And one thing for sure is that systems learned very quickly that young people and being held accountable was not equated to being confined in detention. So they knew that they were able to, and one of the lessons learned was they were able to realize that holding a young person accountable can look different. You don't have to put anyone behind bars to hold them accountable. And they were able to use partnerships or develop partnerships across the system and with community-based partnerships to support young people at home. One of the key takeaways that systems looked at as well is looking at their risk assessment instruments and determining who should be in detention that's posing a public safety risk, and who can be maintained at home safely with supports wrapped around that young person. It allowed them to be creative in building those partnerships. And I will say Pierce County, for example, had already had established a community collaborative that they were working with, but through the pandemic, they were able to go to young people's homes, talk with the young people, talk with the families, and see how they can best be supported, um, and what that looked like, as well. And so they were able to take those things that they heard from the families and the young people to be able to, I'm not sure what's happening with my picture. There, I'm back.
Regina, you're muted now.
Okay, am I back? For some reason, it keeps trying to connect to my phone. So I'll power my phone off and hopefully that works. And so one of the unique things that Pierce County was able to do is utilize that community collaborative when they got concerns from the parents and young people, not necessarily concerns, but what they needed to be supported. They were able to then resource the community and provide young people with laptops if they did not have them. They were able to purchase Zoom licenses for their community providers to be able to make sure that the community-based resources, the programs that young people were assigned to, were able to continue providing services from a virtual platform, as well. That made things a lot easier across the things. So systems provided families with what they needed in the community, and they systems and partners surrounded young people and families to meet those needs. So the virtual check-ins, the treatment appointments, virtual treatment appointments became normal. Parents were also able to participate because they were at home as well. So they were able to give services, and transportation wasn't an issue to get young people to different places. Um, the other thing I will share is that systems were able to pivot funding structures. So, for example, service agreements, the fee for service agreements weren't necessarily working, especially for the smaller community partnerships. So, they were able to shift to a flat fee service structure so that these systems could keep their doors open and provide those needed and critical services to young people as well. So those are some of the high level key things, key takeaways from the research that we did. I'll stop there so that I can give my other panelists an ability to talk. And then hopefully we'll circle back and talk some more about what this looked like from the system perspective.
Thanks so much, Gina. I appreciate that tremendously. Next up, I was hoping to turn to Tracy, but Tracy, I don't know if we have you on stage with us at the moment or how to bring you on. Are you able to speak from where you are?
She was sending a note that she lost the stage access, so we are looking into that. Is it possible that we could shift orders?
Yeah, absolutely. That absolutely no problem whatsoever. Thanks for your help with that, Lisa. So let me pivot then to you, Jeanette. Jeanette Bocanegra is the Executive Director for Justice for Families, and the one who spearheaded this entire panel. So huge thanks and just immense gratitude to Jeanette for bringing us all together here today. But Jeanette, looking back on the past few years from your unique lens in the community, what do you think has been most important in supporting young people and families involved in the justice system at home?
That we provide families and young people with the resources. And though much of what we learned during COVID is the action that we're taking today, young people needed to be closer to communities, resourced in the community, given even the technology that they need, even if they had to check in with probation. What this helped us understand is that there were policies and practices that were harming our children. And because of COVID, we learned that many of us were able to make discretionary decisions, that children can be serviced better in their communities, that it became difficult but even addressing mental health and making sure that much of the resources that were given for kids that were not sent home, that if they did stay in the institution, that disrupted, right, the services. When we talk about education, when we talk about mental health and the resources that young people need while in confinement. But we learned during COVID, and it's beautiful that we can say lessons learned. So how do we put these lessons learned into practice? It's very difficult when a young person is trying to be connected to their family. The unknown during COVID was difficult. Young people also were having a hard time when being discharged from foster care. So we know that COVID really highlighted much of the disparities across systems. And we're talking about juvenile justice, but we also know that this was also an opportunity that we learned that there were other systems that needed to be also transparent, right? During COVID, it disrupted much of the day to day normal living, but it also allowed us to think outside the box, right? It became a challenge, but now how do we do virtual court dates? And we know that going to court is a challenge for families. It's not in the community. You need fun, transportation. It's it's hard when you have to go into those spaces, right? The anxiety of going into a court building. When you have a tablet and now we can do a virtual court hearing or you're meeting with your probation officer. So there were things that were great that we were able to think outside the box and still give the level of support. And there were other things that were hard, right? Kids that could not be released. We also, Gina, we talked about staff. We have to be mindful. Everyone became human. Everyone became human. Now, how do we help each other? This also taught us and me as a community member that it had to be built in community. Those resources have to be in community. And when we talk about how this system support community, we had probation officers that do partner with organizations to provide mentors, to provide coaches, to provide those care packages with food. We also looked at the system with the food disparities. We know that COVID was difficult for families when they weren't notified about certain things. It was the unknown. Everyone was scared. But I also know that this is a great opportunity. This project gave everyone, whether you're a system, an advocate, a family member, a young person, that we can work differently, that we can strengthen in facilities, that they don't need facilities. They need vocational trainings. Many young people struggled when they returned to the community. So how do we strengthen those additional services? We also know that there were staff shortages. COVID highlighted so much of what societal social justice issues that we deal with. And for many years, we blamed the justice system. The justice system has to fix it. We have much to do. We're not there yet, but this project really highlighted how we can do a better job. Our young people are gifted, they talented. How do we tap into it? We also know that there's much happening today as if we didn't go through 3 years of COVID and disparities and unknown. We have to address mental health and we have to be consistent. It's okay now to talk about mental health. But how do we support young people? How do we support families with cultural relevant resources and those opportunities that during COVID we knew we can do it? We all made discretionary decisions to support families, create better opportunities. So though it was hard, and Lisa, what do you take back? You take back a research project that has data on how we can do and what we learned during COVID. We don't need to go into those spaces any longer to make it right. We can do that in the community. We know that the court is not the solution. We also learned that our young people and our families need a fair chance. This is what the report highlighted to me as a parent who supported the project, because we knew that when you have families involved, that we will listen to them. It's about taking action. We no longer need a system to continue disrupting the wellness of young people and their families. And we lost a lot during COVID. There were kids that also were isolated, not knowing what was going on. Young people lost relatives and were not able to mourn and be there. Same thing with staff. We lost staff. Are we doing right by the staff? Did we provide all the necessary tools to do the job well and to make sure that their own family is okay and that their own well-being was okay? So this project pulled everyone together, and we can make a difference. But our young people, and the investment has to be now. Let's put those resources back into the community. Create, what is the call to action? I say you definitely need someone, a parent with lived influence, that can be that bridge in those facilities. We need in person. Our young people need those social connections. We all realize how hard it was to be isolated. We social people. Virtual world is beautiful, but I love me some conferences. I really do. I like the networking. And young people, they wanted to prioritize, and we didn't happen. We also need accountability and transparency. I start giving out vegetables, and I buy mesh bags now, and I say that the mesh bags are for your vegetables, but it's also a message for the system to be transparent. What you're putting in these bags, be transparent with our community. We want to hold everybody accountable, communities, young people, and families, but we're not holding sisters accountable. We knew that we can release a kid and expedite release without looking at a policy. We made discretionary decisions because we wanted kids and families together. Everybody wanted to be with their family. But then we had to learn how to be with our family because we didn't spend so much time, busy world. But what I learned, and I'm going to say proof, that we build community. During those moments, we're demonstrating how do you expand those resources, how you include families. We talk about community, get involved, do the work. We want to, but the community need the resources. The money needs to be redirected so that it is not beyond the 9 to 5, Monday through Friday. COVID was 24/7. Oh, I heard those sirens in my neighborhood constantly. I heard it so much that I thought I was becoming immune to it. So COVID broke us apart, but it also gave us an opportunity to think outside the box and humanize our work, because it's about humanizing our families and our young people. I can go on, but I don't know. Let me know.
This is beautiful, Jeanette. Thank you so much for all that you shared in that. And I think centering the kids and families that are impacted by these policies and practices is just such an important part of this project, and why it was such an honor to partner with you on this. I think our colleague Tracy has rejoined us on the stage, which is a huge win. Thank you so much to the technology team who helped make that happen. So I'm actually going to go back just a couple of slides and turn to Tracy Tucker, who is the Executive Director of the National Juvenile Justice Network. And I'd like to ask you, Tracy, what did you learn from your state advocate partners about effective strategies to get kids home and invest in community supports?
Thank you, Samantha. And thanks everyone that helped to get me back. I appreciate that, working behind the scenes. Um, so yeah, as Samantha mentioned, these are the sort of 5 takeaways that we gathered from advocates. So the National Juvenile Justice Network is an organization that works with state-based advocacy organizations. And then also we have around about 100 alumni of our Youth Justice Leadership Institute, which is a program to develop leaders of color in the field of youth justice reform. And so in working with our members on this project, we came out with these 5 sort of takeaways from the efforts that advocates made during the pandemic. And so with reframing the conversation on safety, the pandemic really sort of placed a focus on carceral settings and the harms associated with these systems. And so advocates were really able to leverage news stories about confinement and conditions to really frame their arguments to push for the release of young people from these facilities. And then also within the youth justice community, I think prior to this, we really had been sort of pushing for youth justice to be viewed as a public health issue. And, the pandemic sort of helped to shed a light on that and sort of broaden our conversations around that, because we know that carceral settings are harmful to young people because of all the traumas associated and the separation from families. And so it really just sort of allowed us to expand these conversations. With regard to the sort of building stakeholder champions, litigation and legislation, and leveraging the youth defender community, we found in talking with our advocates that this really offered sort of a way to sort of deepen relationships with our stakeholders, to engage with them around the ways that we could move young people out of the systems. And I know Gina and both Jeanette have already sort of talked about the ways in which people came together to come up with alternatives and different ways of doing things. And so public defenders were able to use this to come together to strategize, to push both for case-by-case advocacy for young people to come home, as well as looking into different litigation strategies. And there are some examples in the reports. One within Maryland, the Court of Appeals was able to issue an administrative order directing courts to find alternatives to detention and review cases every few weeks. And so then lastly, just with regard to investing in our communities and resources, Jeanette and both Gina have already really talked about this already so beautifully. But what we saw was that jurisdictions were able to either expand, funding to provide community-based services, or they were able to release young people without having sort of these formalized systems in place, which again sort of goes back around that conversation around what is really safety, and sort of what Jeanette has been talking about, and what it really sort of means to be community and to support each other in community. And systems were able to bend and adjust. We deal with these sort of rigid systems where people are always saying things can't be done and this can't be done. But what the pandemic really emphasized for us and showed us is that, systems can adjust and they can bend to meet the needs of youth and families, which is really what they're supposed to be doing in the first place. So those are just some of the takeaways that we were able to contribute to the project from the advocacy standpoint. And with that, I'll turn it back to you, Samantha.
Thanks so much, Tracy. I really appreciate each of you kind of sharing from your unique lens. It's interesting how I think there were similar lessons across the 3 groups, but each one obviously bringing unique perspective and priorities and experiences to the conversation. I want to thank Lisa for putting a flag in the Q&A box. That's where you're welcome to add questions. We would love it. I know it's hard in these virtual spaces to be as interactive as we might otherwise be if we were all together in the same room. But we'd really welcome questions, comments others have as we start to think about how we can kind of build on the progress and create a new normal for justice involved youth. That was one of the things in some of the qualitative interviews that we did, that we heard time and again, is this question of, are these changes going to be sort of temporary crisis response changes from a system perspective, or are they going to help us kind of fundamentally reshape and transform how we administer justice to young people and families in this country and create a new normal? And obviously, I think many of us are hopeful that that will be the case. And kind of building on that, I'd love to start. We could talk all day. So I will happily sort of share questions and facilitate conversation amongst these amazing group of women, but please feel free to jump in with any comments or questions that you have in the Q&A box. But just to start, when we, I think, undertook this project shortly after the onset of the pandemic in 2020, it was a very different world. Here we are 3 years later. I think I used the phrase post-pandemic prior, but I don't like to. And if I did, I would like to retract, because I feel like everything has changed. Early on, I remember the days of thinking that this might be a few weeks or a few months. And I think actually I don't know that there ever will be a post-pandemic world. I think we're just, it's evolving with us. So I'm curious, given all that has changed and where we are today, if Jeanette and Gina and Tracy, and all of you could speak to, what do you think are the current challenges that we're seeing in communities, and what are the sort of current areas that we really need to be attending to as we think about advancing decarceration efforts? Anybody care to go first in responding to that question?
I'll go first, Sam. I think one of the things that became more prevalent to everyone, we kind of know the statistics and how the systems look as far as demographics go. What the pandemic did show, as systems were rapidly releasing young people back to the community to be able to put systems in place and surround them with community-based alternatives, the disparities were alarming there. We found that as systems were releasing young people, it's often the Black and brown kids that stayed behind in the system and were not released to the system. So the racial and ethnic disparities piece is an issue that remains, that we need to address. And looking at all of our services and systems and things that we do through an equity lens may help with that. Making sure that we're looking at our data from that viewpoint will be helpful. And I think the other thing of note, so those of us in the reform space that kind of have been tasked or work with systems to try to make them transformative or things, these are some of the things that we've always pushed, trying to get systems to look at community-based alternatives and making sure they're aware that young people can be maintained at home with services and support. So one thing that the pandemic did, if there is a silver lining, I think for me, was that it showed systems that this can be done. Young people can be served at home and with systems wrapped around them without, public safety measures going up or back. And also, one of the sad things that I've noted now that we're post-pandemic or in the new normal of after this pandemic, the height of the pandemic, the numbers are starting to creep back up. They're going back, the numbers for detention are going back up to pre-pandemic numbers and things like that. So all of the lessons learned through the pandemic have went back to pre-pandemic practices as far as the utilization of detention and all of those lessons learned. So we're talking to systems about reevaluating and looking at their systems for things that went well during the pandemic, and making them into practice, and changing policy so that those things can remain and go back to, the things that work and were more equitable, and were community-based, family-focused services going forward.
Thanks, Gina. I think that's a really important point. Sorry, was someone else going to jump in there?
Yeah, the fear of what we all are witnessing is hard, right? All that is difficult. But until we don't address the issues and be consistent, right? It's post-COVID, and now we're not getting the same resources people were throwing at the community, or no resources, right? Just figure it out. And we had to figure it out. Yes, we had to figure it out as a community. And because I know better, I can do better. But we have not addressed the issues that we realize that have been pulling our young people apart, and the disparities, right? Without young people, it's hard. Gina, they were either not released or just thrown out with no resources. And we have to do better. We can't go back to how we were managing a system. The system is gonna work. I see in on the screen, right? This beautiful presentation, right? Better together, building systems that care. They're all different, but they're all going to do the same thing. They're going to work according to how it was built. And we have to create a new system that works for community, because the one we've been part of is not, it's been just tearing us apart. We say everything is judged with a hammer. That became a sledgehammer, because it's just ripping us apart. And we want the services, right? But we don't need to be penalized when asking for those services. We know you don't have to be penalized if you need mental health. We know you don't have to be penalized if you're fighting addiction because you're not making good choices, right? It's about choices and options, and our young people are not giving that. And together, we can make a difference. Together, we can create a norm that works for our young people. I say, if it's not good enough for your family, it can't be good enough for mine. If it's good for my family, then what I'm prescribing to you should be good for yours as well. So we want young people to thrive. Every family wants a young person to thrive. We want them to be successful. We want them to be independent, a family if they wish, and successful members of society. No parent want any less. So I say, if you don't do good by our black and brown children, I also see a little heart there inside that system. You never know who's gonna knock on your door, because love is powerful, right? Love doesn't discriminate. Love is empathy and compassion. And
I
we all
always
can do a better
appreciate
job. We can all do a better job.
Yeah, I always appreciate your viewpoint, Jeanette, because one thing that the system, the pandemic did show us is that um, families do care, communities do care about these young people, and I think for a system, and I'll speak from a system person, a practitioner at heart. Um, we always think we know best as the system, which is why detention is better. We need to remove them from the home to provide services. Um, you know, but listening to the family and what the needs are, having the family and the young person have input on what's going to work for them, what's going to make them better, what's going to change their trajectory, so that they don't come back to the system, was to me evident with a lot of the practices that had to change, as they let young people go back home. And then the families take ownership of that young person. The communities take ownership of that young person and giving them what they need. Um, and so it's now revisiting and trying to make sure, that the things that worked, showing them that can continue to work, not just through the pandemic, but that the families are the experts in their young person. The communities where this young person was raised and lives. Even though you remove a young person from a community, the young person's going to go back to that community. Why not leave the young person in the community, provide supports around that young person from the community to keep those community ties to make them better moving forward?
I so appreciate you, Gina. You know, you say you part of a system, right? But I don't see you as the system, right? I see you as a partner that is helping us as community members really create a system, not this system, but something that works for our communities. And we learn that we can make a difference. We learn so much, right? Even how to support those who work in the system that we're dealing with hard stuff, right? We talk about wellness and how systems have oppressed our families, but the practices, right, and these policies also affect those who are working in those systems.
I just want to highlight something that was put in the chat. Mr. Marshall shared how horrible it is to see the things that help these young people during the height of the pandemic being taken away. That's exactly what Jeanette, you're sharing about, is making sure that we can resource these programs and things in the community, these community-based alternatives, to keep them going now that we're post-pandemic. Because they worked during the pandemic, they will always work if we give them the opportunity and the resources that they need to keep going.
It's a really great point, Gina. And though it wasn't, given the time of this project, it wasn't a major focus. I think one of the big areas that folks are working through now on the ground is how to leverage some of the ARPA dollars and other resources to do exactly this, try to fill some gaps, continue to provide the services and supports. And it was really striking to me, kind of getting the opportunity to participate in the different, the parent focus group and the practitioner focus group, and in some of the advocate conversations, just how pervasive is not a fair word, but like how much more common this acceptance and acknowledgement that healing and restoration and growth and hope and all of these wonderful things that are going to help address the root causes of negative behaviors happen at home, right? Like regardless of, they're just not going to happen in the same way in a facility. And so just this pivot to really try to be, I think, smart and think about what is bringing people to this system. Jeanette, you've mentioned before the kind of lack of system coordination. Sometimes you hear, not you personally, but we in the field here of the juvenile justice system is sort of a system of last resort. A lot of kids who come into the system have experiences with other systems, child welfare system, education system, that may not have gone well. And so I think that was another kind of theme. And just to lift up, Jen, I heard this some in your comments as well too, but we were really focused on justice and came at this from a kind of a legal system perspective. But just how important that social safety net and networking is for young people and families to prevent them even getting to the system to begin with. And once they do, making sure they have access to not just treatment, though it's important if needed, but also pro-social opportunities, incentives, not just, we're not focused just on punishment and accountability. First of all, accountability does not mean incarceration, but we're not just focused on those pieces. It's like, how do we actually help kids make better choices, giving them hope and showering them with love and providing opportunities and alternatives that they may not have seen or known before. And so it was interesting to me how we heard that message from all stakeholders in the conversations that we had, that the real change happens in community. And so we have to figure out how to center and support community members in whatever, this next phase of justice looks like. Let's see. What I'm wondering if anyone...
There's a question in the chat.
Great.
I mean, in the Q&A, And the question is, what are some ways schools can help move forward and build upon these lessons learned regarding justice-involved youth?
That is such a great question. Does anybody in the group want to? I'm
Oh,
happy, Jeanette.
oh my
Yeah.
goodness. It starts with the schools. And if we start investing so that we can disrupt the school to prison pipeline from suspension to detention to incarceration, then we can talk, right? How do we resource the schools, not with resource officers, but with social workers, counselors, mentors, right? How do we provide our schools with the proper resources? If we just keep building metal detectors, right? We put more school safety officers and not investing in the pro-social component of what young people need and really providing them with with what they need and those schools, you know, I, in my community, I can walk every 4 blocks. There's a school, but it's closed, it's gated. It actually looks like they're training our kids to be part of a juvenile justice system. We also know that the school needs so much investment for our kids. I did get involved. I did get involved because in 2010, when I learned how much it cost New York State to house one kid in a juvenile facility versus what it was costing us in New York to educate our kids and what it was costing us for an after school program, I said we designing a plan for our children to fail. It was costing us almost 300,000 in 2010 and less than 30,000 to educate our young people in a public school and less than 5,000 for an after school program. Today it's almost costing us 800,000. So we're not designing a plan for our children to succeed if that's the amount of money we're investing. We're only asking for, I'm not even sure how to ask now, but to allow our children to thrive, provide our families with the resources. Don't penalize us because we don't have. Don't penalize us because we're asking. COVID also had to teach us how to be in family. So, what are the things that we were able to create so that at least we're not fighting and we're not dealing with domestic disputes? Because it was a high rate of families going through domestic disputes because we didn't know how to spend so much time with each other. We working, we busy. How do we cook together? How do we create healthy meals? Because we're talking about wellness. How do we play board games? Everybody was stuck on technology. So we even learned how to be in family because that too was disrupted by systems that dictate how to be a better parent, child welfare. Another system that dictates I'm going to remove your kid and do a better job. And neither one of them have done a better job. So the schools definitely have to step up and see how they've contributed to a system that we're expecting to be the solution to everything. So I hope I answered the question. I don't know.
I think so. And I would just add, kind of as we're thinking about concrete strategies for that, I think there's a lot of work around improving connections between schools and justice system actors in various communities, and a lot of efforts around implementing more restorative strategies and restorative programs and practices in schools to limit push out into the justice system. And so that's another thing, if that's not familiar or not something that you have in schools in your community, there are a lot of schools experimenting with that. And even just, I mean, I'm a researcher in this group. So putting on my researcher hat, we don't even have a really good information in many communities about like education for kids who are justice involved, and or what proportion of kids who are coming into the system are being referred from schools, because there's just really limited data sharing between different systems. And young people rightfully have confidentiality, and there are some really important protections in there, but just really looking at what role is a school playing. And it could be, a whole school district. It could be a few schools in a school district, but are there opportunities for, trauma education, for education around the impact of push out into the justice system? Are there opportunities to experiment with more restorative approaches and that kind of thing? So I think there's a lot that schools can and are doing, but I just think there's huge variability in how deeply schools have sort of delved into that. And the data is pretty stark that the negative impact of school push out is really disproportionately borne by young people of color, Black and brown kids, compared to white kids. And so there's a real imperative, I think, to take a hard look at that and figure out how to take a different approach in some places.
Samantha, I'll just add to that the National Juvenile Justice Network, our policy platform last year, was on building out transformative schools, and we did some focus groups with young people, and all of the things that y'all are saying is exactly what young people are saying that they need to feel safe and to have healthy school environments. They talked about mentoring programs, they talked about restorative justice programs. So I'm gonna find the link to that and drop it in the chat in just a minute as a resource for folks.
Tracy, that's so important, right? But it's also very crucial for me to educate the families that have
Absolutely.
school age kids, right? Because we trust the system. We trust that when the school says something, right, that's not correct, we go with what the recommendations are, and we agree. We get nervous because our kids are a certain way, and
So
we just push them into that the I say the belly of the beast, asking for help and not knowing.
mhm,
So I encourage as well that we educate those families in the schools,
absolutely.
because sometimes we're the ones that are pushing the kids because we trust that the decisions that the school's making is best, right? A superintendent suspension in New York keeps a kid out of a school for up to a year.
Oh
That's
goodness.
ridiculous, right?
Absolutely.
So certain policies and certain practices in the school system, we need to kind of really support families so that they don't get caught up with how they practice and treat our young people.
Mhm. Yeah, and Jeanette, I think that goes back again to community. I know we keep going back to community, but it's really like envisioning a world where families automatically know where to go when something is happening with their child. Just personally, my daughter had went through a phase where she wasn't wanting to go to school. I didn't quite know what was going on, but I knew, like, oh, I'm going to talk to her pediatrician. I'm going to find out this. I'm going to find out that. And I don't think that there's enough of that information just out in the world for families to be able to access. And if we can build up our communities so where they're so rich with services and resources that it's just obvious where families need to go when something happens with one of their children.
That's exactly what I was going to say, Tracy, is that we need to empower families,
Mm-hmm.
that they do know best and know where to go and to be able to access those resources without the system involvement, um, as well. Because you're right, parents a lot of times do rely on the system. I've worked in jurisdictions in the past that um, parents like are requesting for a young person to be arrested or put in detention because they don't feel like they can handle the young person, instead of going to a service provider to be able to get some help and empowerment with family conflict issues or different things like that.
It's so important, Regina. When I hear a system person says, "Well, it's the family that wants the young person locked up." It's the family, right? No, we don't want them locked up. We just don't want to worry. We don't sleep if they out in the street, and we know that young people, they like to be defiant and break curfew and hang out. There's certain things that they do because of their age, and how do we have those discussions with them in a healthy way? That's something families need to learn. How can I have a healthy conversation about adolescent development? We know that those are the hardest years, and our kids, Regina, cannot be an adolescent, right? Our young kids cannot be childish because they're not supposed to. That's criminal behavior. So then they don't grow up healthy. We say that they even families, oh no, they can't do that. Oh, we scared for their development when they out in the street. And so we have to create those better stronger conversations. How do we support families and help them understand so that they advocating for the right things and not using the not understanding as a punitive and you have the best solution system? Because when a parent asks for help, is that if we don't know, I'm gonna do a better job. And I asked for tutoring. I said he's getting to school late, and this kid is running reckless around the community and not going to school. Did that family say that? No. So how do we support families to help them understand language and help them not just be part of disrupting our young people's development? It's difficult, right? Children are not born with a manual. We don't have a kid in a manual, and teenagers are very challenging to raise. They growing up, they want to be independent, they're trying to fit in, the peer pressure, right? Body changes, so they go through a lot, and we're not allowing them to experience that in a healthy way.
It's funny that you say that way, Jeanette, because one thing that came to mind for me, having been someone who worked on resources to try to help parents kind of navigate the system and educate. And I remember being in a parent group one time and they were like, I do need the education for like how this works, but like, I don't need to know how to survive the system. I need to know how to advocate for my kid in the system. Like, where is that handbook? Where is that support? And I think the truth is that's not just a resource we can write down and hand off, right? That only comes through peer support and peer connections. And it's just not formalized in a way that's easy to hand off. And I think that just reiterates the need for really supporting young people and their whole ecosystem, including their families, including their siblings. That's something that another finding that came up in the work that we did in conversations with folks. It really is in community that this is all going to happen. And so wrapping everyone in that ecosystem with supports. And the one other comment I just wanted to make is I'm really pleased someone raised the point about schools, because the school environment is such a central environment and ecosystem for kids. I was doing a focus group with young people not too long ago where we were supposed to be talking about something totally different. Like, what are the needs that you have? How can we meet those needs? How could we actually invest in what you really need? The entire conversation. And I did 2 of these back to back. Both of the entire conversations just focused on school. It was kid driven. That is where they are spending their days. That is where they are, connecting with other adults or not. That is where they're getting resources or not. And not to say everything has to go through the schools, but it just was a really good reminder for me, who's maybe a few years out of school, that how salient that community is in young people's lives. And so I think there's a lot of impact and a lot of power in that system in particular. It really struck me. I was like, wow, we weren't even really, schools were like one of like, it was a small part of what we were thinking about. And the kids were like, no, the school is everything. The school is everything to us. So that was really powerful. Let's pivot. Oh, yep. Sorry.
I wanted to just kind of veggie back, right? I say veggie back. I wanted to veggie back on what you said, Samantha. It's important. The schools are the first interaction with kids and their social environment, right? And every morning when I look at my kids in the neighborhood going to school, I see that some of them are happy and they want to go to school, and then I see others that they don't want to go, and I wonder, like, did something happen before home, or did something happen in school that you don't want to go back? And I say it's up to the teacher, right, and those who work in the school system to make the day great for our young people or to make it miserable. And many do a job that is very questionable everywhere, right? But why does a kid go happy and then next thing you know they don't want to go back? We have to work differently and make learning fun and they can thrive. And many of our young people are not given that opportunity.
It's a really important point, Jeanette. Thank you for sharing that. Let's pivot to a second, because all of you are working, each of you is working in many jurisdictions throughout the country. Are there other interesting innovations or, kind of shifting to a bit more strengths focused? Are there any practices or policies or programs or things happening that you feel like are effectively filling the gap, are meeting the needs? What are those looking like in communities now in this reality of where we are kind of 3 years into this COVID time? Does anything come to mind?
I think
Well,
for me, a couple of the things that come to mind is one, family engaged case planning is a push, um, especially in probation departments and things, making sure that they're including the family voice in developing what services and supports they put around young people. And also on a larger scale, it's just opportunity focused probation services. So it's not necessarily just watching a young person to make sure that they're following the court orders, but absolutely wrapping around services and opportunities for young people to help them make the change that you want to see, and be successful in the community. And success is defined a number of different ways, right? But what is success to the young person and the family, and what supports do we need to put around that young person to make sure that they're successful?
Regina, I love the fact that probation had a foot in the door. Some jurisdictions work very closely with amazing partners and foundations that they already had a foot in the door in working with families, creating, being part of case planning and probation transformation. And so they had a foot in the door because they've been working tirelessly, right? How do we create a better system? There's still a lot of work to be done, right? So the topic of this is building a better system that cares. And what this even project helped me understand that other systems need to be more transparent, right? That are pushing our kids into systems, child welfare, right? How is that system? How do we create a system that doesn't disrupt and rip families apart? What worked and what I see with one particular jurisdiction that I say also had great like first steps in engaging families is in Harris County, right? Lessons learned. And they hired a family engagement specialist who's rooted in the community, looking at things that worked and how do we continue now strengthening communities so that communities can look at these policies, right? We talk about policies and practices, and it's hard when you're dealing with trauma and trying to juggle understanding a system. But the lesson learned is that we're gonna look at policies, right? Because there were folks that were able to make a discretionary decision without looking at a policy. So there were great things that we need to continue tapping into and not fear because of what we're witnessing today with those same issues that were not addressed appropriately. So I'm gonna mute myself. I know
Don't mute yourself, Jeanette. Don't mute yourself. And I think another movement that we're seeing that's been successful is the credible messenger movement. So like Jeanette spoke, with family engagement and the community, having them involved, but actually listening to people with lived experience, and having them inform practices for systems as well has been very successful across the country. And that we're seeing more of that. Not only are they working with young people, um, so young people are looking at someone that's been in their shoes or similar shoes, that they're learning from, but also helping the system be better at what they do as well for young people.
That's such a great point, both of you. Thank you both for sharing. And please don't mute at all. I think that it's really helpful. The conversation, I think, is where some of the connections are made and where some of these ideas, you know, that are kind of growing. Like as soon as we sort of document some of this, the world continues to evolve. So it's exciting to think about it. And I'm really pleased, Gina, that you mentioned credible messenger mentoring. I keep coming back to that. And, you know, I've had several conversations lately around what do alternatives look like? So if not, you know, youth incarceration, then what? And it's wonderful to have things like that, to have things like other community-based programs that just are doing a much better job that at supporting kids and also holding young people accountable. And unpacking that accountability piece, I think, is really a big part of where all of us will be working in the coming months, because it doesn't, you know, accountability does not equate to punishment, and it doesn't equate to incarceration for sure. And I don't know about you, but I am most accountable to the people that I care about and are part of my ecosystem. That's what's going to keep me in check and in line. And so figuring out how to return that power to families and communities, I think, is a really key. And return seems like, sorry, I don't mean return. I mean respect and center that, because it has always existed, but systems don't always act as if that's the case.
Yeah, I think there was a question about sharing more about the credible messenger program that I talked about. And so what systems are doing is, and I apologize for, I'm in DC, so we hear sirens all the time. So I apologize for that. But what we're seeing is systems and programs are putting together young adults. When I say young adults, they're adults, but I call them young adults because I'm a little bit over the middle age range. So everybody's a young adult to me. But they're utilizing people that have been in the system before, whether that be the youth justice system or the adult system as well, that have had some success in the community. And they've been vetted, interviewed, you know, so that the system knows they're on the right track. But they're able to go in and work with these young people in the system. So they've been able to go into detention facilities or long-term placement facilities, develop relationships and mentorships with young people. And then what's most successful is when that continues, when the young person is released back into the community, they can maintain that mentorship with that individual to help them through maybe difficult, rough spots. They have someone that they can lean on and talk through issues and things with. So it just we're finding a lot of success with that program.
That's awesome, Gina. And I just dropped a link. There are many resources on it, but I did drop a link to the Credible Messenger Justice Center that is a nice kind of clearinghouse for some of the research around it and some of the work around it. I think it's a growing, you know, I think it's a great program to look into and a great alternative. I think it's also a beautiful acknowledgement and experience for the mentors as well. So whereas historically we might have excluded people who might have experience with the system or have some of these unique expertise and also unique kind of speaking perspectives from healing and treatment, I love that we're kind of centering that and leveraging that to help support young people. I think it's a wonderful thing. Really great point. Well, we're almost at time, but I want to just ask and kind of land on a last question to our speakers. If anyone wants to speak a little bit about kind of the call to action that you would give to those of us on the call as we're thinking about how to continue to build on progress and create this new normal. And I've just put up on the backdrop here a couple of quotes from parents, just again to make sure we're kind of centering those who are most impacted by these policies and practices. Does anyone want to share what you would say is kind of your call to action as we think about next steps in this space?
My call to action came in 2012 when we released the Families Unlocking Futures report. And because of that report, we were able to create advisory in Seattle for families, an advisory committee. In New York, the parent support program. In Harris County, we had the family engagement specialist. In Ohio, a family navigator. So we're with that project, we were able to create a family voice. With this, we're creating community spaces where families and young people can go into and get the resources and tap into those resources so that we're not being ripped apart by systems of care that don't care about our black or brown children. So we're building that system, right? We're teaching communities that it can be done. We're doing it in New York. And what we do in New York, we go across to another state and do it bigger and better. And when we talk about credible messenger, it's also birthed in New York. So I'm like a proud New Yorker from the Bronx. We're building community. We learn that it takes us to build what we want for our young people. So that's my call to action. Continue building even systems, providing them with what they need so they can do a better job. We want families to do a better job. We want communities to do a better job. The system also needs to do a better job. So how do we team up and provide young people with what they need? You know, when systems do good, communities do better, young people do better. We all want to benefit, and we can all benefit.
And that's what I was going to say, Jeanette. As far from the system perspective, my call to action would be to collaborate and share power. Um, we should all know, and research shows us that we can't do this alone. So invite people in. Systems can't be afraid to share power, not only with other agencies and organizations that service the same kids, but with families and young people having their voice at the table. Um, I don't think a collaboration is complete without that community and young person's voice in the space as well. So just that would be my call to action is collaborate and not be afraid to share power.
And that, again, I would just add to that as well. Again, it's all about community and listening to youth and families about what it is that they need. And I would just urge everyone not to sort of lose the sense of urgency that we all had with regard to COVID, because young people and families are still impacted and suffering in these systems, and so we still have work to do. We still need to be pushing to get young people back in the communities.
I think that's such an important point and such a powerful point to end on, Tracy, is there was so much conversation early on about how suddenly, getting kids out of these incarceration settings was a matter of life and death. And I feel like so many people who work in the system are like, it was a matter of life and death before now. Like, it's always been this important. And so now everybody sees that, and let's build on that urgency to really figure out a new way and a new normal. Because it wasn't just COVID who made that so. It's been that way. And everyone else, just welcome to the party. Glad you're catching on, and let's kind of continue and move forward. So with that, I'll just say thank you so much to everyone who came and chatted with us. We in the last slide, we have our contact information. Any and all of us would be happy to follow up if you have any other questions or follow-up questions. So grateful for your time. I know everyone's busy, and just appreciate the questions and the conversation here. Very nice to spend some time with all of you, and hope our paths cross again soon. Lisa, I'll turn it back to you.
Thank you so much. And we just want to thank our wonderful panel today, Jeanette, Tracy, Regina, and Samantha, for not only what you shared today, but we really want to thank you for the work you're doing on behalf of youth and families. I mean, this, in a time that things can feel daunting, to hear of the good work you're all doing really provides a sense of hope and a pathway forward, and a call to action for all of us. So we appreciate your leadership in many different ways. I want to just encourage everyone As you've been participating, there's a number of different ways that you can continue to stay engaged throughout the day. There's lightning talks you can join, there's wellness rooms, all different kinds of things. But before you head out to those things, on the right side of your screen, there's a little, the second to last icon is where you can click to find the survey for this session. And we really would appreciate if you could complete the lesson strategies and pathway forward survey, because your insights help us as we plan future summits and sessions. So as Samantha said, thank you for joining us. Thank you for your engagement, and thank you for all the good work you all are doing. It's our only path forward, as Tracy said, is to collaborate. So we appreciate everyone's time, attendance, and please complete the survey.
Thanks, Lisa.
So I believe I end this session